So my name's Gavin Boyle and I'm the Chief Executive of the University of Hospitals of Derby and Burton. So we're a large acute provider. We've got 5 sites, 12,500 people, 52 operating theatres serving communities in southern Derbyshire and east and southeast Staffordshire. I think looking over the past year, the biggest game changer for the NHS has undoubtedly been the publication of the long-term plan. I think having a clear sense of what the financial settlement for the NHS is likely to be, but also a clear strategic steer, particularly with regard to the development of integrated care systems, I think is extremely helpful and really sets a very clear direction for the NHS going forward over the next 5 years. So I think the opportunities that come out of the long-term plan for the NHS is this issue of how do we get health and care providers within a particular geography to work more closely together. I mean, one of the biggest challenges I face as the Chief Executive of an acute hospital is the year-on-year rise in demand, so 4% increase in non-elective admissions each year for the last 3 or 4 years. It's not sustainable. And I think if we can work in a more joined-up way as a healthcare system and identify when patients, perhaps with a long-term condition, are deteriorating so that we can avoid a crisis and avoid an admission to hospital, that's got to be the way to go. So for me as a leader in the NHS, there are 2 things that are real priorities for me. One is to deliver the best possible patient care we can and to serve our communities as a healthcare provider as best as we possibly can. But it's also about making the lives of our people easier, because workforce is one of our bigger challenges too. And I think if we can use GS1 standards and digital technology to improve care and improve the safety of care for our patients, but also make the lives of our people easier, then that's a huge enabler to meeting some of the challenges that we face as a health and care system. So I think one of the greatest things that the GS1 standards and the application of this technology brings to the NHS is that it's a cheap, easy, tried and tested way of capturing data, and it's the data that matters. So if we're going to be able to manage a complex health and care system, then the data that underpins that will be critical. And GS1 standards and Scan for Safety has been a huge enabler to that. So I think we need to build on the lessons of the last few years and apply that learning to the challenges of tomorrow. So I think this has been a fantastic event, and when I reflect on some of the key learning over the last couple of days, I think there was a few things that stand out. One is we need to see beyond the technology. Sometimes we get caught up in a debate about the technical details, and really what we need to see are the real stories that lie behind it, the real benefits that accrue for patients and our people as a result of applying this technology. So for me, there's something about trying to explain the benefits more clearly from the perspective of our patients, but also from the point of view of our people as well. I think this is a great event. I mean, there are few opportunities, I think, to get such an eclectic mix of people together. You've got clinical people, you've got people in supporting roles like me, techie people, but actually all just talking in a really kind of open and quite a creative way about how we might all work together to do the best thing for our patients.